This is Dr. Vince Bellonzi. Let's talk a little bit about the big pharmaceutical companies, commonly called Big Pharma. I think there's been a lot more evidence coming out that they're not to be trusted. That's pretty evident. In fact, fewer and fewer people are trusting the big pharmaceutical companies. But one thing I want to talk about is how you're influenced by them. They've studied very well how to market to you. They used to market to the doctors, but that only goes so far. Unfortunately, doctors get so busy that may be all the knowledge they have is what comes straight for the company. In fact, you should learn a little bit about how this whole system works. Maybe you already know. But the FDA is not out there to protect you. The FDA is, in a sense, controlled by those pharmaceutical companies. Do you know that the salaries of the FDA workers are actually paid by the pharmaceutical companies? You probably thought it was by you. Did you know that most of the people who approve the drugs are also paid by the companies that they're regulating? It's not a very clean system at all. In fact, you're not getting any kind of an unbiased opinion when the FDA makes an opinion and allows a drug to go out there. In fact, most companies don't bother to submit negative studies. They don't have to. They only have to submit the studies that they want to. Now, if I make something and I only have to submit the positive studies, I'll probably have a better time getting things approved. You should look into that a little bit. But let's get back where we started. I want you to be more educated and a little less trusting of everything that you're told. The pharmaceutical companies are out there to make money. What you have to do is learn when it's enough. Remember that you're being treated by somebody whose primary tool is the drugs. You can do a much better job in many cases by learning how to take care of yourself. The pharmaceutical companies are, again, out there to make money, and that's their bottom line. And they have the ability to now market to you. So that's really what I want you to start thinking about. How many drug commercials do you watch? How many things do you see as far as ads? Think of all the pharmaceutical messages that you get. This drug allows you to traipse through the flowers. That drug allows you to be clear of your allergies. That drug helps you if you're depressed. Depression, in some ways, isn't even real. It's a chemical imbalance. In a lot of cases, it's a natural response. But now we've assigned a drug to it. We've convinced young kids from the time that they're just very young that they're sick, in a sense, and they're going to need drugs for their whole life. Let me give you an example. I have a good friend who's a medical doctor, and he had a patient not too long ago, and that patient came in and sat down. The exam started, and the patient said to the doctor, "Well, I would like the purple pill." The doctor said to the patient, "Do you know what the purple pill does?" The patient said, "No, I just want the purple pill." He had just seen a commercial not too long ago on the purple pill. Not even knowing what it did, he went and asked his doctor to write him a prescription. Isn't that exactly what the commercial told him to do? How much are you really in control, and how much is the media in control of you? Do you believe everything that you see? And how many times have you actually performed what they ask you to do on TV? I think if you look at it, you've done it more often than not. I don't think it's a real good idea for drug companies to advertise on the media to the average person. As people get more educated and are maybe a little higher in their tax brackets, it does seem that they are less inclined to trust the drug companies. But there are a lot of people out there who watch and believe everything that they see on that tube. So be careful. Don't trust anybody. Obtain the information and use things the way they're supposed to be used. Realize that you are being programmed. It's A Brave New World, and that's a book written by a gentleman named Huxley. You might look it up. In that book, they used a drug to control the population. It was actually proposed before Congress that Prozac and Lipitor be put into the drinking water. Now, some people say it was a joke, but it was proposed before Congress. Do you think the manufacturers would be happy if that happened? It was seriously considered. The drug companies, again, are out there to make money. They advertise to you so you'll go buy their drugs, whether you need them or not. So whether it's right or wrong, you need to be a little more aware of how you're being programmed and what it might make you do. The drug is not always the answer. In fact, most of the time, it's only the short-term fix, if not all the time. So be aware, be informed, get educated, and go in with both eyes open. Be real careful about what you believe in the media and who's talking to you. Big Pharma loves to control you. Look up what your reticular activating system does. You can be programmed, and that's what the drug companies are doing. I don't think it's the right way to go, and that's why I'm making this video. I want you to seriously consider how influenced you have been in the past, and I want you to be awake when you're influenced in the future. The pharmaceutical companies right now are in control. They do control the government. They have a lot of control that they exert over medical doctors. Realize that they fund the school. In fact, if you trace the history of the medical schools, it was the drug manufacturers who originally, the snake oil salesman, that name's applied to other groups now, but the drug manufacturers who are linked to petroleum, and that's a whole new story. But the drug manufacturers went and said they would fund the medical schools if they would prescribe drugs. If you have ever been to a medical school, you'll realize how much influence the drug companies continue to have over the education of young doctors. And those doctors come out ready and willing to prescribe. And then the whole system continues as the drug manufacturers continue to fund the doctor's lifestyle. Now it's in little ways, free samples. It can be an educational seminar, but that seminar's in Hawaii and most of the doctors are surfing. It's not a perfect system. So be aware of that. Be aware of the influence that's put on medical doctors to prescribe you certain drugs, to get you hooked on those drugs, to get you dependent on those drugs, to use their drugs as the primary tool in their treatment. How many doctors talk to you about nutrition? How many times has the doctor told you how important that exercise is? How many doctors even talk to you about the function of your body? Or do they simply hear out your symptoms and apply the appropriate chemical? Again, wake up, learn how to take care of yourself, realize that things are being controlled at much higher level than you may be aware of. All this is not unbiased information. I'll leave you with a thought. The New England Journal of Medicine, pretty well-respected journal among doctors, found that they couldn't find enough unbiased reviewers to review articles in the journal. They couldn't find very many people that weren't getting something from the drug manufacturers as far as either a gift or perhaps a straight salary. So they changed their allowance to set a certain limit. If I remember right, it was about $10,000. So now you can be a reviewer in that particular journal if you don't get more than $10,000, and I don't remember the exact time period. So if you can't find anybody that's unbiased to review an article on a drug, what makes you think you can find somebody unbiased to make a judgment on whether you should use the drug or not? Again, this is Dr. Vincent Bellonzi. It's a pleasure talking to you. My objective is to have you think. Please do that. Thank you.